Good morning, everyone. This is Rana al Qawasmi from Sheikh Jarrah, Jerusalem, occupied Palestine. It took me a lot of courage, efforts, and risks to be with all of you here today. As I left my family, my people, my country, and everything I own and know. My dreams, my fears, and my future, all back in Palestine, my homeland. And I don't even know how my homeland will look like when I go back home. It's the war. It never leaves things the way they were before. And the heaviest burdens and the expensive prices of it lay on the poor, the sick, the most vulnerable, and the weak. And now let me share a bit with you about my life. I was born and lived in Jerusalem, the Holy Land, that never lived in peace. I was born to a conflict that has been ongoing for decades, and it's now 75 years old. I was raised to love Palestine, my homeland, with its beautiful shores, nature, olive trees, history, culture, religious and touristic areas, and many other characteristics that only exist in Palestine. For me, it's the center of the world. As a child, I didn't understand much about politics, but I knew we were always watched, stopped, and checked. We were always threatened by seeing soldiers and police. We were always in danger. One morning in July 2009, I woke up to find Israeli soldiers breaking into my neighbor's house and forcing them to leave and displacing them to live in the street. That morning, I grew up and I understood it's the Israeli occupation that makes all Palestinians live in constant fear of being displaced and being refugees, or being arrested or imprisoned for life, being humiliated, beaten, or shot to death, or simply seeing our houses being demolished and our olive trees burnt. Passing every day through high security checkpoints and driving beside an apartheid wall that consumed our land and separated our villages and cities, living under bombardment with international prohibited phosphorus bombs. It's a constant threat from being ethnically cleansed and facing genocide only because we are Palestinians by an apartheid settler colonial regime. In Jerusalem, where I live, there are a number of national hospitals that treat Palestinian patients from Jerusalem, Gaza, and the West Bank. I remember visiting a friend of my family, Mohammed. He's a cancer patient in Augusta Victoria Hospital, which is the only hospital in Jerusalem that supplies cancer treatment. Our friend used to drive for 3 hours from Gaza every time he had chemotherapy. Can you imagine how hard was it for Mohammed to fight against cancer while he crossed high security checkpoints, facing hardships through traveling for long distances on a weekly basis to get treatment in the hospital and then all the way back home? Him and a number of thousands of Palestinian patients suffer from similar hardships for reaching their hospitals to get treatment for their chronic and life-threatening diseases, since there is no enough care in Palestinian territories. And this, if only they succeed to get a permit to cross to these hospitals, where they are referred to receive their treatment. Some of them are even transferred by ambulances to checkpoints where they need to be offloaded of the ambulances, check into checkpoints and cross these high security checkpoints, and then catch another ambulances that have permit to drive to the hospital, which is a clear act of dehumanization and ignorance of the Palestinian patients' lives. Hearing the story of our friend and other patients has changed my life. Since I understood that helping Palestinian patients is the thing I want to do. And here I am, working for almost a decade on helping Palestinian patients get healthcare while saving their dignity, human rights, and most important, saving their lives. In Palestine, the health system suffers from multiple burdens. It is underdeveloped, weak. It doesn't have any needed elements of structure, budget, trained and experienced physician, equipment that allow it to function efficiently and serve Palestinians with the needed care. In addition, Palestinian lands are segregated by numerous checkpoints and settlements that prevents Palestinians from moving freely between districts and cities. These checkpoints can be closed anytime for undetermined periods, which blocks people's movement, which also prevents them from approaching healthcare facilities. Many medical equipment, material, and medications are not allowed to Palestine by Israeli occupation. Water and electricity are also controlled by the occupation and are allowed in low amounts that make it very hard for hospitals to survive. Healthcare facilities, hospitals, and clinics are frequently demolished. Ambulances and healthcare workers are attacked by the occupation. The same occupation prevents Palestinians from building new hospitals, which makes it very hard for this health system to supply these patients with the needed services. Leading this Ministry of Health to transfer and refer all these Palestinians to get medical care outside its facilities, in private sector or even abroad, which puts this Ministry of Health under huge financial burden that consumes almost half of its budget annually. So this is the case in normal days. How do you think about war times, when thousands of injured and sick people are in need for urgent treatment, and there is no hope for them, only this fragile health system? So me and my team succeeded to implement the first of its kind. It's an electronic referral system, the first implemented and created in this Palestinian Ministry of Health to facilitate the transfer and the treatment of Palestinian patients. We are working consistently on helping, strengthening, and building the capacity of this health system so it can be more capable to nationalize its services, train its human resources, and lower its financial expenses so it can improve the quality of care it can supply for Palestinian patients and save their lives. A great part of my role that I really love, focus on people, talking to them, building treatment plans and transfers for them, and knowing more about their needs and the difficulties they face every day. I've been working with hundreds of Palestinians annually. I know them by name. I feel happy for them when they feel better and feel sad when they leave this world. Their survival is my success. I accompany them for long treatments that take years and years. I feel blessed for being able to help them. I want to tell you about Layan, a baby girl and one of my most beloved patients. She has cancer. She's been treated for cancer for 5 years, till a level that the doctors reached to a time they said, we can no more help Layan. But I never stopped. I kept searching until I reached a doctor that can save Layan with bone marrow transplant from an international donor center abroad. It actually gives me a good feeling for doing something good for my people and help them because they suffered 75 years under occupation and have been deprived from their human rights while they are displaced, concentrated in refugee camps, attacked, killed, and dehumanized. And now, I would like to ask you imagine a girl that lives with her beloved and loving family and in a nice house, that walks with her friends under the sunshine to school, with the sounds of birds and sea waves, through fields full of olive trees, dates, and fruit, carrying her dreams, plans, toys, and futures. All of a sudden, the sun turns black. The fields are shaking. Missiles are dropping from the sky. Fear, shouts, cries are all over. People and ambulances are rushing to hospitals. And this girl becomes an orphan with no home, no family, like many other children. Actually, this is a simple story of what's happening now in the only open-air prison where 2.2 million people are locked for 17 years. This is Gaza. And today, while I'm standing here on the 32nd day of war, I know that this health system that I've been trying to work on to save lives is no longer capable to save these lives. It's actually destroyed by Israeli occupation bombardment in Gaza. This bombardment is targeting 2.2 million civilians in their homes, UNRWA, schools, hospitals. Half of them are children, and the majority of them are refugees. Till this moment, 45 healthcare centers and hospitals are out of service. They ran out of fuel, electricity, medical supplies, and equipment. Medical teams are exhausted, and we lost 50 of them. Till the day, we lost more than 10,000 martyrs. Half of them are children, 2,600 of them are women, 500 are elderly, and more than 2,000 under the rubble. We have also more than 25,000 injured. Almost 1.5 million Gazans enforcedly displaced from their houses. These numbers are rising every second. Actually, these people are not numbers or statistics. Each and every one of them had a name, story, family, and dreams. The situation my homeland is living, in general, and in Gaza in specific, is the worst since the Nakba, the catastrophe in 1948. We are actually living a humanitarian crisis with a huge violation of human rights and international law, a clear genocide, and multiple war crimes. But here I am, I'm thinking of the patients I used to work for, the amputated, the hundreds of children, the traumatized orphans. I'm thinking of approximately 50,000 pregnant women in Gaza, cancer and chronic disease patients, the injured who need complicated procedures. I can't stop worrying about 2.2 million of my people who don't have access to clean water, food, sanitation, baby and feminine care kits. The deaf who can't hear the bombs and call for help. And many, many more endless stories of suffering. I wonder, what does equity and equality mean to them? What do they think about a future if they have the chance to see this future? I'm thinking of how can I be a source of help to my people who have been suffering from 75 years of occupation. The words can't describe the catastrophe, but I believe that there will be a day when Palestine will be free and Palestinians will gain their full deserved rights. I believe in you as my big Atlantic Fellows for Health Equity family, for calling for justice and help me advocate not only for Palestinians' rights, but also all the oppressed people, minorities, misrepresented and most vulnerable. I'm grateful for the opportunity of being with you all through this year and through this fellowship, learning from you and having you as dear friends. Thank you for listening.